Okay.
Dok, matanong ko lang dahil na-bring up ni Dr. Limpinito, no? She was saying na parang the COVID now presents itself in a different way compared to how it used to present itself. Can you give us more details on how different the COVID you're dealing with is now?
Okay, so I've read some articles na a variant-driven, tumataas ang kaso, no? So highly infectious, more cases, no? So when you have more cases, you have more varied presentation also of COVID. And we've been seeing a lot of these they will present with stroke, they will present with a different manifestation, not only respiratory symptoms, no? So nag-iba ngayon ang ano niya, ang presentation na because mainly expected yan kasi pag dumadami ang kaso, dumadami rin ang spectrum of clinical manifestations at saka yung presentation. No? So this is expected. This is expected. Ang importante lang dito na we should be expecting na some of these manifestations may not be the typical, yung respiratory. Some of them are presenting with diarrhea, abdominal pain, no? Vomiting. They thought na it's not COVID, no? Some of them are presenting with stroke or headache or na walang malay na bumaba yung ano niya, sensorium. So these are some of the manifestations na nakikita natin ngayon.
So paano yan? Kasi usual na you don't associate diarrhea with COVID. At what point do you have to consult a doctor? Or at what point do you want to get tested for COVID?
Yan ang ano ko, Ami, no? Kung meron kang something very unusual sa katawan mo, no? Yung mga ganong manifestations. Kasama naman yan sa information campaign natin, no? Na COVID can also present with extra pulmonary manifestations. So if you have those manifestations and you have possible source or contact na nangyayari, then you really have to try to contact the doctor and get some advice on what to do.
What about in the course of treatment, Doc? Kasi parang I'm hearing more and more of yung parang gumagaling na, tapos biglang the very next day or 2 days after, biglang intubate. Meron bang nagbabago rin ba yung course ng virus? I'm just wondering, no? Kasi I'm hearing more and more of similar stories. Yung parang gumagaling na, tapos biglang namatay. Ganun. Yeah.
That's what we call the unpredictability of the infection, no? Because of the multifaceted na pathophysiology niya. Because it's not just respiratory. You have itong mga tinatawag natin na hypercoagulable, no? Nagko-throw ka ng thrombosis or blood clots sa brain mo or sa any part of your body that anytime, including yung blood clots doon sa lungs mo, anytime it can happen, that can also be possible complications ng mga biglaang komplikasyon na secondary pa rin sa COVID. Expected yan, Lucy. Expected yan.